in the camera.
All right, no, that's fine. I got the camera going. So I need someone to be a patient. So we're talking about techniques to increase tone, right? Increase readiness to move. So Caleb, you're going to sit there and face Stacy, right? And so we're looking at somebody, although Caleb has got fabulous posture, I'd like you to be someone who's very low tone and perhaps doesn't have function on their right side. Okay. Actually, yeah, right side, left side. Let's do left side, that way the camera can see. So, you know, here's somebody who's relatively floppy, and the arm, if you look at the right arm versus the left, you'll notice his right arm is kind of supporting by his body, and the left arm is just hanging. So the difference between someone with low tone is that you can have people who are weak in their arm and they know where their limb is. And then you have people who are weak in their arm and don't know where their limb is. And how you can see the difference really quickly is this wouldn't be something that Caleb would do normally if he knew where that limb was. He would hold on to it, right? He wouldn't want it to flop off. He would go find it and hold on to it because this would be awkward. So you would want to keep it close to him so it doesn't flop and hang off. So someone who doesn't have sensory awareness, they're going to be here and they're not going to know. So part of the things that you do with low tone, whether it be weakness or sensory information, is try to give them as much information as possible about that arm and have it be something that's automatic. So one of the things that you do, you can relax, change your posture, is very generically is tapping. There's a video in the pre-lab lecture for next week that demonstrates it, but you've already done this. Remember in ortho, we did tapping to the quad. So after a total knee replacement or hip replacement, sometimes we talk about how it's hard for them to get that contraction going, so we may tap and say, you tighten this muscle right here. The same is true for the neurological population. If I want Caleb to get that bicep going, I'm going to tap that bicep. And I'm going to have him look at it, and I might actually do the movement for him, right? Okay. Bring that hand to your mouth. Bring it to your mouth. There you go. Okay. Right, and then you can augment tapping using the same principles by using the electrical stim. So you can use the neuromuscular stimulator, put the electrodes on that muscle belly, and use electrical tapping to get that muscle to fire. And so we're not going to go into too much practice. It's the same stuff we've done before. You do have to remember muscle function and origins and insertions. So when you're looking at loss of strength and loss of function, you'll have to remember from kinesiology, what is the working muscle, which muscle is missing. So if somebody has got this floppy arm and they're not able to weight bear, you know, they're missing some tricep. And if they're not able to even recover this arm and pull it up into their lap to get it supported, they're missing some biceps. So you have to know muscle functions really well. And then just like with the electrical stim, you go to the muscle belly because that's where the motor points are. Okay? So that's one technique, tapping. And the one that I want to talk about a little bit more is using writing reactions. And writing reactions are automatic postural adjustments to changes in gravity. So Caleb sitting upright and his head automatically comes up because we want our eyes to be upright and looking around. Someone who doesn't have a normal writing reaction are going to let the head hang, right? This is someone who doesn't have a lot of control of their extensors, but we can use the willingness and the need to want to look up, that primitive reflex to want to look up, to help facilitate some increase in tone in here. So I'm going to show, I'm doing it on his neck because it's easy, but I'm going to just kind of show you what you can do for the upper extremity here. And you can use positions. Scoot forward. One of the positions I like to use for low tone folks is high sitting. So that's sitting where your femurs are, and your knees are quite a bit lower than your hips. And if you get a chance to try that now, don't sit over there, but the table is good. Oops, some of these copies are closed. When you're in high sitting, you can try the table. And just like in transfers, you remember how we got our patients to the edge of the seat before we had them come up to standing? And the reason we did that is that when you've got weight bearing in your ischial tuberosities, it automatically allows your legs to activate. You can use those same principles in high sitting. Get somebody in high sitting, if they don't activate that riding reaction, they're going to slip off the edge. And then there's a tendency to want to use those hands for support. You can see Caleb does that automatically, right? That nice riding reaction. When we lean forward, the natural tendency is for the head to do what? up, right? Trunk extends, head comes up. And then if you want to come back to the middle, pushing your feet into the ground, you're riding, you're maybe extending your elbows, pressing your stance. The same is true if I'm going to go over here. I'm going to get to a point, I don't want to go that distance anymore, and I'm going to want to correct. So we use those riding reactions, postural riding reactions, to increase tone. You can also use bouncing to increase tone. So I've put low tone people on therapy balls. You just have to be very careful with them and have two people. So he's got this floppy arm, right? And it likes to fall off the edge. So you're going to place that in the weight bearing position. And then you're going to use your body to approximate this limb. And that means, that word, approximation, means to provide input to bring the joint surfaces together. When I say approximation, I'm talking about joint surfaces. Proximal joint surfaces will activate his trunk. So you can see I've taken my body, I'm supporting his hand, I've wrapped my arm around the inside of his arm so that when I help him extend his elbow with my trunk, my arm is also up against his rib cage. He's getting all this input into his trunk. I've got his shoulder up here. And if he wanted to flex that elbow and slump, he can't do it. He can't do it, right? And now we're going to start to do some
weight bearing in that time period is like kind of like a muscle strengthening.
Right. So we've got to get stability first, trunk control first, then we can be mobile. So in order for him to be stable in his trunk, he's got to know that he's got a right and a left side, and he's got to know how to correct to midline. So you can move in lots of different postures and teach him how to use this side. If he's getting pretty good at this, or I want to challenge this, I would ask him to take that right hand, left hand, and put it on this opposite thigh. Okay? And then back. Put it back over there. And reach across. And back. And can you touch my knee? See, now he's doing a weight shift and he's really having to hold with his thumb. If he's really floppy, try and flop down. He can't go anywhere, right? So he has to learn that he's got this right side has to function. Otherwise, he's going to fall. So high sitting is a really nice way to do that. Using your limbs to get control of their trunks. And we'll talk about eating more. I don't want to do that because I got people distracted all this time. So when you practice, I want you to think about positions where your patient has no choice but to be tall. You can do high sitting in a hospital room. You can do it if they're on IVs. You can do it if they're on ventilators. You can do it if they have a tracheostomy, right? You can do it in a skilled nursing facility at the bedside. His beds are up and down. Or you can do it in the gym. It's a very functional way to get them active. You'll notice that his legs are quite active in this position. And just by repositioning him here, he's had to use his legs for a writing response. And we can do things with a bedside table. I can have him push that table and pull it back, right? I can have him reach for things in his room. I can say, can you grab that pillow and hand it to me, right? And all the while, I'm giving him the opportunity to experience what it's like to have this right side be involved in maintaining his stability, and therefore increasing his tone. So it's not just this passive floppy piece that goes along to the right. So make sure you try using your body against somebody's trunk. Just practice some weight shifts in different directions, and then as you're the patient, see if you can, without warning, lose control. And if you as a therapist are going to be able to prevent that loss of balance through your position. Okay? All right, give it a try.